And were given new hope after they were told a potentially life-saving drug is to be made available on the NHS.
Cara's parents had faced having to find the £150,000 to fund their daughter's treatment. The same drug was used to treat Bradley Lowry. His mother, Gemma, campaigned to make it available on the health service.
Chris Jepson has been talking to her and hearing how the drug is going to make a difference to around 100 children every year.
Cara Armstrong's been having chemotherapy for neuroblastoma, but needs the drug dinutuximab, which could help save her life. Her mum today found out she no longer has to raise the funds to pay for this treatment.
Just felt so relieved, just felt like a huge weight off our shoulders. Quite emotional really, thinking that this is going to kind of improve her chances and make it a lot more feasible that she survives this awful disease. We knew it was going to be sort of hundreds of thousands we'd have to find, and we'd started doing some fundraising for cancer research, so I had a bit of a team in place, but I was feeling really daunted by it. It's a lot of money to have to find.
The drug's been approved by NICE, which assesses cost effectiveness of cancer treatments. It means Cara and hundreds of other children can now have the immunotherapy in conjunction with other treatments on the NHS.
It is a component of a treatment which will result in cure for about 50% of children. It's not a treatment on its own because we use it in combination with all the other treatments that we've demonstrated help and work against neuroblastoma. But without it, we will be less successful. With it, we can be more successful.
Bradley Lowry's mum, Gemma, has campaigned for the NHS to provide the drug for free after it initially helped put his cancer into remission. And 1 year on from his death, she's delighted by this decision.
I'm overjoyed. It's absolutely amazing. Honestly, I couldn't be happier. This treatment was definitely needed, and it's fantastic that NICE and the pharmaceutical company, Uesa Pharma, have worked together, negotiated and managed to come up with a deal that suits both of them.
What kind of hope do you think that this brings to other families who have children that are ill?
So hope's a massive word, and I love the word hope, because where you've got hope, you've got fight and you've got life. And that's what it gives. It gives our family hope that their children are going to beat this awful disease. It gives them hope that they're going to grow up into beautiful young adults and live the rest of their life.
Gemma will continue fundraising to help other families who no longer have the added pressure of finding funds.
The alternative would be them having to seek treatment abroad and having to raise money for that because it wouldn't be funded in any other way. In respect to the drug itself, immunotherapy is a way forward and a promising way forward in terms of new developments and new drugs and new opportunities.
After a month in hospital, Cara returns home to celebrate her second birthday tomorrow. A double celebration for her family, who can now concentrate on getting her better. Chris Jepson, ITV News, County Durham.